Hello, everyone. Welcome back to our How To Corner. In today's episode, we will be talking about how do I know if I have a shoulder slash cuff injury. And this episode will be presented by Dr. Will Gray III, that's me, and 3Gen Sports Science Institute. Before we get started today, everybody, who's watching or listening to this episode, please hit the like button, the subscribe button, follow, share, and comment on any of the actual problems that you're having with your shoulder or any other injury, and we'll try to cover those in on this channel and in these type of actual presentations or videos going forward. So let's get to the topic. With a cuff or shoulder injury, the first thing you always are weary of if you have a shoulder issue is, do you think you've torn your shoulder, right? So the things that I like to get the patient to think about, the client to think about, is what do you feel? Pinching, stabbing, throbbing? Is that something that you notice? If so, those are indicators of possible or shoulder pathology. Obviously, it gets deeper. There are deeper layers to it. But when you have the pinching, the stabbing pain with movement, and your shoulder constantly throbs, there's probably something going on. Can you lift your arm slash objects? Can you just lift your arm to do your hair, brush your teeth? Are you having issues lifting, a case of water or a gallon of milk? And if so, do you have pain with that initial movement? If that's the case, once again, there's probably a shoulder pathology at play. And then the last piece, and my favorite, is can you sleep? What we don't realize is that when we sleep, we heal. So if this issue is occurring at night, interrupting our sleep, our comfort, our ability to be able to, rest, then we have two problems at play. You probably have something going on that needs to be addressed in our shoulder. And then last but not least, we're not being able to heal regardless if what we think is going on is minor. So we have to address those two in order to make sure that, we're able to get back to full health. And if we have those three questions in our mind and we answer them, a certain way, then that moves on to our next part of the talk, which is when I go to the doctor for my shoulder. When I go, when do I go? For me, there's three, levers to that also. Is when I have high level of pain, when I'm unable to explain my achy shoulder, and I cannot find relief at all. And if you think about that, it's going to affect a lot of things. You've been able to lift your arm, can you sleep? You're having all different types of stabbing, achy, throbbing pain. So there's a lot of things that are making you say, hey, this is not, something that I think I can get over myself. So I need to visit a provider. Now, I'm going to give a little bit of bonus here. Not every provider is created equal. So when you're thinking about finding providers of any kind, I would suggest to definitely ask people who have probably experienced that issue and then seek the knowledge of those people and then go and do some research yourself before you go and to find a provider, because we're in a place now in the world of healthcare. There's a lot more surgeries that are being done than actual conservative treatments, and that's a whole different conversation within itself. But sometimes there are a lot more people out here who are getting bad information, and there are issues that don't necessarily require procedure. Now, I'm pretty sure you're wondering, after you think about, when I to go to the doctor and do I actually have a torn shoulder? You're probably wondering, how did you hurt yourself? A lot of times, guys, believe it or not, it's very simple. There are probably some degenerative changes that have occurred over time. We get old, things tend to wear out, things that tend to get a little bit, um, weaker. Then we have injury from overuse. If you're a long time baseball player, or you're a person that's in the yard with your kid throwing the ball, or maybe you're a weekend warrior that likes to play softball, or maybe you're a CrossFit person, maybe you're a person that, just plays basketball a lot on the weekends recreationally, then guess what, guys? Injury comes from overuse. We're doing things that we've done our whole lives, but we're not doing things away from the activity that we enjoy to make sure that we stay, healthy. And that leads to the last piece, weakness. As we all get older, man, our body ages, weakness occurs. Weakness leads to a lot of these injuries because we don't have the stability, the strength, or even the ability to be able to withstand the body. I mean, what we put in our body, up against. What are we trying to do with it? So instead of us actually addressing it, we just kind of do what we done when we were 16, 17, 18, or 25 or 30. And then we realize that crap, we can't do this. We're not healing quick enough. Or my favorite, you're young and you're just playing through it. Yeah, that's not a thing either. So you're going to get to a point where you're going to have to address it. And what you're going to find out that sometimes you're your own worst enemy because what makes you great makes you just as bad. Sometimes your motivation to continue to play tends to be the problem, versus you addressing the issue. So when you have a question of how did you hurt yourself, if you really think about it, you can pretty much come up with the answer. So last but not least, what's next? So do you go to a doctor visit? Do you get imaging? What are your treatment options? For me, doctor visits, definitely want to find somebody who's capable. If you can find, a good family doc, a good orthopedist, or a great physical therapist of any kind, you can find an answer. I would err on the side of if I'm ranking these in orders, I would try to get to an ortho. If I can't get to an ortho, I'll get to a physical therapist who knows what they're doing. Keyword: who knows what they're doing. And once again, not every healthcare provider is created equal. I'm in a space where I'm realizing I haven't educated a lot of people of that because we think that that's the case, and not everybody can, say that honestly without, some people getting offended. But the truth is, you need to find the right people. So if I'm ranking them, if you have a primary care that you trust, that's cool. Go to them. Hopefully, they'll direct you to an orthopedist that they trust. Once again, doesn't mean that the person they send you to is the best person or the person that get your answer, but you try to hope that's the case. But still, wherever they recommend you, ask questions about research. We're in the world of in the internet 2025. Like at this point in time, you can find anything you need online. And then last but not least, if you can't get to primary care that gives you a good recommendation and you just heard of a good orthopedist that you think people trust in the community or that's highly recommended, then you can just go to them directly, depending on where you are, obviously, in what state and stuff like that. Or you can find your physical therapist. Most physical therapists in America have direct access, so you can go in there, and a lot of times you'll have physical therapists who are really legit, and they're able to direct you to, hey man, you need to go to the doctor, and this is the person I recommend because I've seen these amount of surgeries from this person. I've seen their approaches to, recovery, as well as, I've seen their conservative approaches too. So the imaging, when you go to most places, they're going to get you an X-ray. That's just really looking for fractures or any type of swelling they can visually see in the X-ray, or arthritis of any kind. Arthritis doesn't necessarily cause pain, by the way. It causes stiffness, limitation in motion and movement. Severe arthritis can cause pain because of the degenerative nature of it, but for the most part, arthritis does not mean that you're going to have pain all the time. That's a misconception. The other piece is what type of imaging do you want to ask for or what you think should occur. If you get an X-ray and they don't see anything, then an MRI should be the next thing you get to as soon as possible, which comes from the recommendation of an ortho, most likely. So, and then like I said, you also have PTs who can, do things as far as getting you in the right spot and recommend imaging based on what they found too. And then, that interdisciplinary approach for treatment is a good way to be able to get you in front of right people. So treatment options for me, I break it down to three different options. Conservative treatment is one. Two, medication. Conservative treatment for me, I put in the option of like I'm doing things to be able to overcome it, not just taking the medication. I'm doing rehab of some kind, right, to get my shoulder strong as it can. See, can I help it heal, scar down some? And then the medication part is like injections, trial injections. And then the last piece is surgery, obviously. So that's three options for me. What option fits you? It's really depending on what you have going on with your shoulder after you go to the doctor and figure out what's going on. And then that approach is your decision. Me personally, I would probably do rehabilitation and really lock in on it and try my best to see what the tear is and how big it is and how much, rehab have ability to help based on that. That determines a lot. And then after that, I would go, from there, whether I want to try injection or so on and so forth. Some people go injection, then rehab, but it's a lot of conversations we can have about that, and we will have about later on the channel. But for now, your treatment options are in that order. So hopefully, today's talk we were able to help. If you have any particular questions, comments, or things you want us to discuss, please subscribe, like, follow. You can also send us a DM on Instagram at 3Gen Physical Therapy, and then also you can hop on our webpage and just go to booking, and then schedule something like that. Or, like I said, just hop in the comments and just give us a shout, man. But anyway, for everybody who's been listening, thank you so much for pressing play. Please share the information also. And if you're looking for us to do more content, please stay tuned. And with that being said, everyone, I hope you have a blessed one. I'll catch you in the next one.